needle. These start out separated and unbuckled.
So do you have a trocar,
Yes.
the long tube that goes into the abdomen?
So these are placed laparoscopically.
Right. So inserted around the...
And then around the stomach. And I'll demonstrate what that looks like on our little stomach. Here's our stomach. And this is near the top of the stomach. Here we have, we place a balloon in the stomach that is about 20 cc's. And that sizes our little pouch, we call it. And then we wrap the band around that. And then we do take some of the stomach, bring it over the band, and sew it to the top part. And that helps fix the band in position.
So the patient is under general anesthesia or local?
General anesthesia.
They have a large nasogastric tube placed, blows up a little balloon into the stomach, so when you put the tube inside, you can see where that stomach is.
Exactly.
Because the camera inside the stomach.
Yes.
Then you use another trocar or a long insertion tube to put that band, and with your other hand, you then pull it. Yeah, pull it together, tie it. Yes. And then you have the capability of putting a reservoir on your chest wall or your abdominal wall.
This actually goes on the muscle wall.
Muscle
it's sewn onto the muscle wall.
Right.
And it then can accept a needle. So it's under the skin and fatty tissue. You can't see it or feel it. But in the office or under x-ray, we can see that.
Right.
Usually just in the office.
Right.
And then we can place a needle in.
And then inflate the band inside the stomach.
And we can use that to inflate and deflate the band.
Oh, show us that. This is exciting. Oh, I like that.
We use saline.
Yeah. So it opens and closes. So it makes that band tighter around the stomach.
That's correct.
So
the idea with the band is that we make it tight enough so that the food will hold up above the band and make people feel full.
So this surgery is good because it's adjustable, reversible, you said.
It is. Although most people keep their bands as long as they can, it is easy to remove.
Okay. And then you would change how much saline you put in because you want to change how much food intake.
Exactly. You want to get it to the point where, very similar to a gastric bypass, half a cup to a cup of food will make people feel full. And these procedures also create a lot less hunger for patients. There is some food intolerance. Certain things like bread, rice, pasta, tortillas that may expand or absorb water are difficult to do. People have to avoid those things. Carbonation is very difficult. A little too fizzy.
Oh, okay.
Kind of just comes up the nose.
Oh, that's not
so
so
sodas,
good.
most people can't do their sodas, and,
Right.
and they can't do a lot of the, the high carbohydrates that can keep us heavy.
Okay. Now, so the first two procedures, gastric bypass and duodenal switch, they stay in the hospital?
They do. It's usually a 2 to 3 day stay in the hospital.
Okay. And this one, they go home?
And this one's about 80% go home that same day.
The same day?
Yeah.
Not even 23 hours?
No, it's usually just a couple hours after, and they're good to go.
So the next day post-op, what does the person feel?
Most people are sore from the procedure, like any laparoscopic procedure from the instruments. But other than that, there's really not that much that they feel.
They can eat?
Yeah, well, they can drink.
They
we
can
have
drink.
patients on liquids for the first 2 weeks with all of these procedures.
Okay.
As the healing process occurs.
So they drink things like chocolate Ensure or stuff like that?
Yeah, they do. They have first very thin liquids, broth, things like that.
Broth,
and then go to the thicker liquids, shakes, protein drinks, things like that. And then on to softer, mushy food for a third week, and then regular food after that.
Okay.
It's not a baby food lifestyle. It's regular food prepared the way people like it. They do have to learn to eat a certain way. Small bites, chewed well, eat slowly, and eat a small volume. If they eat too fast, too much, or too big a bite, it can be very painful.
You'll get heartburn?
Yeah, you get a very painful feeling. You may even regurgitate.
Oh, regurgitate, okay, because it just is too tight.
It's too tight.
Right, and they have to learn to adjust to that.
Exactly.
Okay, and also, even with the lap banding, because you do suture a little bit of the stomach to itself,
Yes.
that takes time for that to heal.
Yes, it does. So the main part of that first month is really allowing everything to heal up properly, and then you're ready for food.
So prior to seeing you, a bariatric surgeon or a weight loss surgeon, these people have seen their internal medicine doctor or their family practice doctor, who then say to them that they're okay to have this procedure.
That's usually the case. Patients have to usually be somewhere around 80 to 100 pounds over their ideal weight. Often they have illnesses that go along with increased weight: type 2 diabetes, high blood pressure, high cholesterol, heart disease, asthma, arthritis. They're usually their daily activities have become limited. They may be less mobile, which of course creates a very vicious cycle. The less mobile people are, the harder it is to lose weight.
Now, these people who come to you, do they come referred by themselves, or they come, their doctor told them, or they...
We see a wide variety. A lot of it is through the internet and patients' self-referral. These bands have national ad campaigns, and so we kind of get funneled to patients in that way. We do see a primary care referral, and of course our own patient base is a great spokespeople for the procedures, and also help bring more patients.
Now the first two procedures, the gastric bypass and the duodenal switch, those, the weight loss is within the first year.
Yes, and it's very fast. Patients lose 80–90% of their excess weight during that first year.
And this one takes 2 years.
It usually takes a couple of years. That's correct.
So what would they expect if they have a lap banding? What would they expect after the first 6 months?
Well, at the first year, patients lose somewhere about 40% of their excess weight on average.
So already the first month they're on a fairly restricted diet post-op because they're not eating
They are, but the band actually isn't really working. It's placed in a neutral position. It's not inflated. Once the month is completed, we start to do the band inflations.
Oh, I see. So you don't really, it's not that constricted.
Right. In its neutral position, you can eat pretty normally.
Oh, so you can still stuff their face.
Absolutely.
Eat chocolate bonbons.
Yes.
Okay. So then the first post-op month, they go to your office.
Yes.
That's when you do the saline and start constricting.
Yes.
And you do this gradually, like a little bit more every month?
Exactly.
And when do you do, so you would constrict a little bit each month?
About every 2 weeks to start out.
Oh, every 2 weeks?
Yes.
And so how often?
It takes 2 or 3 of these adjustments to get it working. As people lose weight, the fat around the stomach and within the wall of the stomach goes away. Our middle fat, which causes most of our illnesses, actually goes away quickly. And so as they lose weight, the stomach gets thinner. And they occasionally will come in to get the band inflated further.
Okay.
So the average number of adjustments for the first year is around 5 to 6. Patients may have adjustments into the second year, really rarely after that.
Oh, so you can still adjust into the second year?
You can go even in the 5th, 6th, or 7th year.
Because everything's still patent?
Yes.
All the tubes?
Yeah.
Okay. And have you had, what's the percentage of people who want it removed? Very low?
Very low. I would
Nationwide?
Say, yeah, 99% of patients keep their bands. We don't know how long they last. They're made out of silicone. We know from breast implant studies that they may last at least 20 to 25 years. The longest studies are out of Europe, Italy and Spain, 10 and 12 years. None of those patients had the band removed from old age or deterioration.
And they were happy with it? They maintained their weight loss?
Yeah, the 90% of patients were able to keep about 62% of their excess weight off long term. With the gastric bypass, we see that statistic to be about 68% long term.
So it's about the same?
About the same.
Now, the last few years we've seen very prominent people on television and film who've had gastric bypass or whatever, and they've had the more traditional surgery. Is that because the lap banding was not as popular at that time? Because this is like the last 5 years.
I think that's true. We've only in the last couple of years were we able to get 5-year studies here in the United States that showed its efficacy and its durability. When you start seeing these 5-year studies that have good results, that's when you start to see the popularity of these procedures ramp up.
Now let's get to the real details. So the chubbiest person you've ever operated on for lap banding is how many pounds?
Nearly 600 pounds.
And then the smallest person is...
Smallest person, we have patients even maybe 180, 190 pounds.
Because they really should be 100 pounds.
Right, her ideal rate is closer to 100 pounds.
Yeah.
And they may have things like type 2 diabetes or something like that that could effectively be erased with significant weight loss.
And then the biggest person you ever did gastric bypass?
About the same.
The same?
Yes.
Okay. And the same thing for the duodenal switch?
Yes, but although I don't do the